Welcome to an insightful look into South Africa's healthcare revolution through the National Health Insurance Bill, commonly known as the NHI Bill. This pivotal legislation is set to redefine healthcare access across the nation. Let's dive into the details of the NHI Bill. Please note that all information in this presentation is subject to change. This presentation does not constitute advice and is intended for information purposes only. The NHI Bill, rooted in the principles of the South African Constitution, is a plan to ensure every South African citizen has access to quality healthcare services. Signed into law in June 2023, the bill represents a transformative step towards making healthcare a constitutional right for all South Africans. It is designed to be a centralized fund financed by taxes and employer contributions aimed at equitable access and efficient resource allocation. In a surprising turn of events, the National Council of Provinces passed the NHI Bill to the Presidency in December 2023, despite concerns over its constitutional and economic implications. President Cyril Ramaphosa now faces a critical decision to assent to the bill or refer it back for revisions, with the possibility of a constitutional court review looming. The National Health Insurance Bill in South Africa holds great promise for enhancing healthcare access and outcomes across the nation. However, it's not without its challenges, including funding issues, administrative complexities, and resistance from private healthcare sectors. Achieving universal healthcare coverage, a key goal of the NHI, necessitates collaboration with the private sector. Despite potential legal and constitutional hurdles, transforming the healthcare system is a significant undertaking that won't be immediate. It's anticipated to take a decade to fully implement the NHI, during which time existing medical aid schemes will largely stay as they are. Let's explore what the NHI is set to offer, bearing in mind, although its full scope is still being fine-tuned. Firstly, primary and preventative care. This includes consultations with a range of healthcare professionals, routine checkups and screenings for common diseases, vital vaccinations and immunizations, family planning and reproductive health services, and mental health services. Next, we have chronic disease management, offering treatment for conditions like diabetes, hypertension, and HIV and AIDS, access to essential medications and medical supplies, plus ongoing support and monitoring from healthcare professionals. When it comes to hospitalization and inpatient care, the NHI plans to cover hospital stays, surgeries, and other inpatient procedures, access to specialized medical services and advanced technologies, as well as rehabilitation and physiotherapy post-hospitalization. Lastly, under essential medical supplies and technologies, we can expect prescription medications and vital medical supplies, diagnostic tests and imaging services including X-rays and MRIs, with emergency services and ambulance transport. Will everyone be able to access private healthcare, and to what extent? The NHI in South Africa is designed to ensure that every citizen and legal resident has access to a defined set of essential healthcare services, free at the point of use, regardless of their income or socioeconomic status. This initiative aims to provide universal quality healthcare to all. Is there still a place for private medical scheme and other healthcare products? Yes. In the NHI framework, private medical schemes are expected to have a role, although the specifics of this role are still being determined. The extent of their involvement will depend on the final structure and design of the NHI. How will the NHI be funded? Firstly, through general taxes. A substantial part of the NHI funding is expected to come from an increase in general taxes. This strategy is designed to ensure that everyone contributes according to their financial ability, fostering a spirit of solidarity, ensuring equitable access to healthcare. Next, we have employer-employee contributions. In a system similar to unemployment insurance, employers may be required to collect and submit contributions from their employees directly to the NHI fund. This approach not only broadens the funding base, but also promotes a culture of shared responsibility. The government is contemplating adjustments to the medical scheme levy. This tax, currently levied on a private medical scheme contributions, might see a reduction, with a portion of the revenue being redirected to support the NHI. The other potential sources being explored include the increasing of sin tax on products like tobacco and alcohol, offering voluntary prepayment options, and forging potential partnerships with the private sector. How will NHI be rolled out? The journey begins with pilot testing. In this phase, selected regions will implement NHI functions, allowing for the collection of valuable data and the refinement of procedures. Next comes gradual expansion. Here, NHI services will progressively reach additional areas. This expansion will be carefully managed, taking into account available funding infrastructure capabilities and logistical considerations. A key focus will be building on existing systems. This means optimizing public healthcare infrastructure and exploring potential partnerships with the private sector to enhance service delivery. And finally, continuous improvement. The NHI is committed to evolving. It will continuously adapt to meet changing healthcare needs and incorporate feedback from a wide range of stakeholders. The National Health Insurance Bill is a crucial step towards equitable healthcare in South Africa. It represents a commitment with a future where quality healthcare is a right for all. As we progress through this decade-long transformation, the NHI Bill is a beacon of hope and a testament to the impact of collective effort and a visionary leadership in creating a more inclusive healthcare system. Thanks for watching.